Hello everyone, I hope you guys are doing good. Today we will start the series of lecture of forensic medicine. That too we will discuss about different types of injury. I have already explained you the classification of injury and now here I am gonna start abrasion. This would be the first thing that we will discuss in this type of injury. Abrasion involves the damage of the superficial epithelial layer of the skin. Now here is the diagram that explains the different layers of skin. Usually the epidermis layer, this layer is damaged in case of the abrasion. Your abrasion won't reach rest other layers of your skin, so it is easily curable and it heals very fast as compared to the other wound that we will be dealing with. Okay, so it mainly occurs due to friction against the rough surface, be it a wall or a brick or something of that sort which is not very even. Cyclists often refer this abrasion as road rash. When you slip on the road and unfortunately you end up getting abrasion on your skin. It happens most of the time with the people who are rider, who are the cyclist. We will deal with different types of abrasion as the lecture proceeds, be it scratch or linear abrasion or your pressure abrasion, that is also known as crushing or friction abrasion, then imprint or impact content of pattern abrasion. Then we will learn about the age of abrasion. This table is of great importance as questions are often asked from this table in examination. So we will learn about each of this duration along with what happens when the time proceeds to the abrasion, then circumstances of abrasion along with its medico-legal importance. As we are dealing with the forensic medicine, so it is very important to know what are the medical aspects of the certain thing that we are dealing with, be it a normal injury or anything. Okay, so the scratch or the linear abrasion is mostly caused when skin comes in contact with some kind of sharp or any pointed object, be it a finger length or pen. Usually a kind of scratch is observed. You must have seen that or may have experienced that in your childhood itself. What happens is when, for an example, this is a piece of nail, okay, and this is your skin. So if it comes in your contact of your skin, it will take a piece, a layer of skin along with itself, something like this. This is a nail, okay, and it will just scratch the skin and take a layer of skin along with itself. So what would happen? We will be left with a clean area of the skin. In the case of sexual assaults and child abuse, mostly this fingernail abrasions are observed. Here is the pictorial representation of all the types of abrasion that we will be dealing with. This is a linear abrasion, okay, and nail scratch, impression of teeth. This is the imprint abrasion. We will learn about each of these in detail. Look, this is linear abrasion. Then we have this pressure abrasion, that is also termed as crushing abrasion or friction abrasion. Every abrasion has derived its name from the pattern that is observed or what happens to the layer of the skin whenever it comes in contact with any of such substances leading to the abrasion. This ligature mark shows the pressure abrasion. As the name suggests, some kind of pressure is applied to the skin, which is why the abrasion is caused. Okay, so like direct impact or linear pressure is caused to the rough object on the skin, as I have already explained to you, like the ligature, or in the case of hanging. In the case of hanging, mostly this kind of abrasion is observed. Fine. Then we have this imprint abrasion, that is also known as pattern abrasion, contact abrasion or impact abrasion. This is the imprint abrasion. A grill-like image is formed. A grill-like pattern is formed on the skin of the victim. It is observed whenever a perpendicular force is applied to the skin and the skin, it gets crushed perpendicular, like this is your skin, and somewhat like this the force will be applied to the skin. So what would happen? The depression will be formed on the surface of the skin. Look, it is written here, abrasion is slightly depressed below the surface of the skin. Keep this in mind that this patterned abrasion is a variation of a pressure abrasion itself. So somewhat it is kind of similar to this. It is mostly observed in the area where the skin is extremely thin and it covers the bony prominence. Okay, I hope this much is clear to you. Now we have this table which beautifully explains the age of abrasion to you. When uh, first of all, let me make it very clear, this is very minimum or no bleeding, hence the scarring and is not very permanent in this case, and healing is faster as compared to other forms of injury that we will be dealing with. When the abrasion is fresh, about 2 to 24 hours, you would observe some kind of serum or blood oozing out from it. It is mostly bright red in the color at that point of time, and as the exudate dries, there will be some reddish scab left. Okay, then as the 2 to 3 days proceed, there will be some reddish brown scab. Earlier we had this red color followed by some reddish brown color. We are left with reddish brown color. Okay, then dark brown color. We have this dark brown color as the time proceeds. Earlier it was 2 to 24 hours, and 2 to 3 days, and 4 to 5 days. With time, this dark brown color turns to brownish black BB, and it starts falling off. Okay, the entire table is important, but there are some lines which are very important. You just have to keep in the mind the duration and the color that is observed. First, we have red, then reddish brown scab, then this dark brown scab, followed by brownish black scab. Okay, then the scab starts falling out by 7 to 12 days, means by 1 week scab would dry and it will start falling out, and the skin would then start healing up. If more than 1 week proceeds, new collagen fiber will start developing on that skin, the damaged portion, and no scar or very few scar would be left. Then we have the circumstances of abrasion. In cases of accident or assault, be it sexual assault or anything, there will be some abrasion developed on the body of the victim, on the face of the victim, on the body of the victim. And in case of struggle, there are chances that the face or body of the culprit might have some signs of abrasion as well. In case of heart attack, if the person falls forward, they may have the chances of receiving this abrasion on their nose and cheek portion. As we have studied, the portion which is very thin in the entire body would receive some kind of abrasion. Okay, and there might be no injuries in the upper limb. Also, on the palmar surface of the hand can receive some abrasion in case of the person who is falling. In case you fall, you must try to, people try to save themselves, and they mostly use their palm, and this palm often gets compromised. Alcoholics, if they fall backward, they might get abrasion. Hysterical women may suffer from abrasion in accessible areas like forearms and over their faces. Then we have the most important portion of this entire lecture, the medico-legal importance of the abrasion. Throughout the study of abrasion, you will get the site of impact and direction of impact. Now, nature of injury could also be figured out by the study of abrasion. Here we have the section for grievous hurt, that is IPC section 320. And then the weapon that is responsible for causing the abrasion can also be figured out. Age of injury can be determined. We have read the entire table that was based on the age of injury. That the color of the abrasion reveals lots and lots of fact about the time span throughout the causation of injury. Then if open wood, dust, grease, sand will be present, that would help you to determine the scene of crime. From scene of crime to age of injury to the nature of injury, weapon and everything, site of impact as well, could be determined from the normal abrasion. I hope you have understood the lecture very well. Thank you so much.